Hello, everyone. So I'm Gabrielle. I'm the founder of the Motherhood Center, and today I have our fabulous Renee with us. Renee is also our lactation consultant and breastfeeding educator, and a big part of the Motherhood Center team. So we are so excited to have her here today, and we are going to be sharing some information about breastfeeding and some tidbits, hopefully, which are going to be helpful and maybe even inspirational on your breastfeeding journey. So today we are going to be learning about the benefits or maybe even the reasons for lactation consulting.
So I think a great benefit is you can go over to mom's house, you can get her comfortable where she's wanting to nurse that baby so that you get good positioning there with the mom in her own setting. We can do that at the office too, but I feel like there's more of a benefit to do it at home. So we would do a feed with the baby when I'm there. We'd weigh the baby before and after that feed. We're going to watch to see how well that baby's nursing. Be sure we're checking on that good latch, making any adjustments we need with latch and positioning. Make sure that baby's swallowing well, they're transferring the milk, they're getting what they need. We'll go over their history of labor and how things went in the hospital during labor and after the baby was born. We'll talk about how mom is doing. What else do you need? How are you doing with your calorie intake, with your fluids? Do you have enough help? Are you getting that rest?
Mhm.
And then we'll go over any pumping if that needs to be talked about, pumping issues, if potentially we're needing to supplement the baby, how we do that to keep that baby wanting to come to the breast, but being sure though that we're getting baby all the food that they need.
Okay, very good. So, and now I would like to talk to you, Renee, a little bit. So often we hear from our clients that breastfeeding hurts and they maybe stop breastfeeding because it's hurting. Can you tell us a little bit about that?
So pain is not normal at any stage of the game with anything you're doing, nursing, pumping, anything. So you can be sore in the beginning, like my nipples are sore, but pain again is never normal. And usually the number one reason is a latch issue. So getting that great deep latch with that baby can
Hmm.
usually prevent all of that. That's
Okay.
usually the main cause.
Okay, very good. And so that is so important to know because you hear all the stories and before we were even doing this little segment here, our camera lady was sharing with us the traumatic experience her mom had, and so of course now if she would be on her breastfeeding journey, that's kind of in her mind, right? Like, okay, it's going to hurt. I don't know if I
Right.
can do it. And so
Right.
yes, so the bottom line is that it should not be hurting.
It should not hurt. No, not at all.
Okay, so we kind of talked about the breastfeeding classes and all the important things you can learn about breastfeeding. And so now I would like to ask you, Renee, because you do a lot of consultations, right? And primarily you do consultations in clients' homes, so you can kind of do
Yes.
it around the baby's feeding schedule. And so what would what would you say kind of like two, three maybe main reasons why you get a phone call?
Um, Pain.
Mm-hmm.
So they're having pain with nursing, which again is not normal. So we need to evaluate what that baby's doing on the breast and how we can work on fixing that issue. Low milk supply would be
Mm-hmm.
another big issue. So we would help mom to figure out why she's got a low milk supply, even if she does have a low milk supply, and again, what we can do to help to increase that supply and what the baby can do because it's their job to be doing that.
Mm-hmm.
Um, and just general consultations too. Just, I want to be sure everything's going okay. Just little tweaks to the system. Can we make this going a little bit better? Peace of mind.
Mm-hmm. Very good. Although breastfeeding, we talk about it and think about it as a natural thing, right? Women done it for thousands of years, but we are still finding new things about breastfeeding. And I know that there is a new study or new kind of a protocol you shared, kind of which came up. So can you share with us a little bit about it?
So the Academy of Breastfeeding Medicine just came out with their new protocol for mastitis, which is a huge 360-degree change from the way we used to treat mastitis. Totally different now. So I think it's important for people to realize that this is a new change that's going on, because still I hear from moms all the time, well, well, everything I just looked up, is totally opposite of what you're telling me. It's that big of a difference right
Wow.
now. And so word is not out there quite yet for that.
Okay. So can you tell us maybe just something, what are kind of the most kind of telling differences?
For mastitis, what
Mm-hmm.
mastitis is. So mastitis is an infection in the breast. So you're going to have a hard area in your breast. The skin's going to be really red and inflamed. It's going to really hurt. You've got a high fever. You're sick. You won't miss it.
Okay. Thank you so much. So as we learned, there's a new protocol about treating mastitis. And so Renee is going to share with us, it's actually quite the opposite to what it was used to be. So Renee, can you share with us a little bit on that?
Sure. So with mastitis, we used to say to empty that breast. So we'd want to pump to empty, nurse to just stimulate, stimulate, empty, empty, empty. And now it's totally the opposite. We want to downplay supply on that side. So we want to do less stimulation to that breast. So it will downplay the milk supply there. Mm-hmm. And then we want to treat all the inflammation, because that was one big thing that they learned. This seems to just start with inflammation and then carry on and then can potentially lead to the infection. So we'll do medications like Advil, Tylenol, lecithin. We want to, of course, increase mom's rest, get her extra help during that period of time. And then one of the biggest takeaways from this new study was we want to quit kicking mom's milk supplies up really high. We really want to be keeping milk supply more along for what the baby needs, or just a little bit over that.
Well, very important information. Thank you, Renee, for sharing. And if you have any concerns, please do reach out to your doctor or lactation consultants so you can have a better and kind of a more enjoyable breastfeeding journey. So we know that there are a lot of different positions to nurse the baby. Can you share with us maybe 2, 3?
Sure. So I think probably the easiest position is the cross cradle transitional hold, because you can move the baby on really well to the breast. You have good control over them, and then you can see their swallowing, which is what we really want to see. So this is a great position. In the early days too, we can do the laid back nursing position where the baby's more up on mama, coming back that way. And then we have the football hold, which is where you would hold the baby over along the side. This is a good hold if you've had a C-section, because then you don't have the baby laying on your incision there. And then also the modified football hold where the baby's coming down from this. So sometimes that helps too for moms. Laying down on your side, which is a really great position to learn so that you can rest while you're nursing the baby. So baby's on the side in the bed with you. Of course, we're going to talk about how we're going to do that very safely with no pillows and no blankets around. Then baby goes back into the bed after the feed. But in that position, you can lay down, you can get rest. You don't have to get up every single time to go feed the baby. And then when the baby's older, you can do the cradle hold, which is where you move the baby over on the crook of your arm. This is not a great position for a little bitty newborn, though, because they tend to get all curled in. So once we have the cross cradle transitional hold and that baby gets bigger and they have better head and neck control, then you can move them over into that cradle position.
Okay, very good.